Hi there, everyone. I am Melissa Wade in the Water from Radio 1 Raleigh, the Light 103.9. And today we have a topic that really relates to a lot of us, especially as African American women. If you have been diagnosed or suffer from uterine fibroids, then like me, you have many questions. I was diagnosed when I was pregnant with my first child. I was told it was small, it shouldn't bother, they would keep their eye on it. But my first question was, what is this? Now, uterine fibroids can, in my case, it was great. It was small, it didn't bother me. But in other cases, it can lead to other complications. And so, also, another fact is that it disproportionately impacts women of color. So, today we have come with our friends at Raleigh Radiology to get some of our questions answered about uterine fibroids. So, joining us today is Dr. Jamie Doster. How are you, Dr. Doster? How are you?
Hi, Melissa. I'm well. Thanks for having me.
Good, good to have you. And it's Doster or Doster? It is
Doster, yeah.
Doster. I was absolutely right about that. I want to make sure I'm right about that. Well, glad to have you. As you heard from my experience, my testimony, I had many questions some years ago. And so with the women that are watching us and listening in right now, I'm sure they're saying the same things like, hey, I'm so glad that you guys are covering this topic. So first of all, start off by telling us a little bit about you and Raleigh Radiology.
Sure. So we're a private practice group here in Raleigh, and I am one of several interventional radiologists, which means we perform minimally invasive procedures. And uterine fibroids are just one of many procedures that we treat.
Well, you just said it. And I said it too. When I was diagnosed and they say, oh, you have uterine fibroids, my first question was, what is it? Can you tell us a little bit about it?
Sure. So uterine fibroids are benign, non-cancerous growths that occur within the uterus, and they often occur during your childbearing years. They're actually pretty common, but not everybody is off. It can be symptomatic. And so some women have them, don't realize they have them, and then others become symptomatic, and then they find out that that's what's going on. They have fibroids. They can vary in size. So some fibroids can be quite small, others can be really large, and they can also vary in the number of fibroids you have. So some women might only have one or two, and other women can have 10 plus fibroids. So it can really vary.
Wow. As you said, some people don't know that they have it because, whatever condition. But like I said, my instance, I didn't realize until I was pregnant. And then the doctor was like, oh, you have a fibroid. So I didn't feel anything prior to. So what are some of the most common symptoms that women may be experiencing right now? And it may answer, what they're going through.
So some of the symptoms can range from pelvic pain and cramping with periods. Heavy menstrual bleeding is probably the most common symptom. And some women I see have bleeding that's so severe during their periods that it can lead to anemia, and it requires them to get monthly blood transfusions. Women can have back pain, bloating, a feeling of fullness in your abdomen, urinary frequency, constipation, and pain with intercourse. Those would be probably the most common symptoms that women can have.
So what are some of the treatment options that's available?
Sure. So, I definitely recommend that women talk to their OBGYN when they find out they have fibroids, because hysterectomy is the surgical treatment option, but a lot of women don't want to have a major surgery. So
Absolutely.
Other options, if they don't have, if they're not too symptomatic, they can be treated medically. There's certain medical therapies out there that you can potentially treat it with. But then there's the procedure that we perform in interventional radiology at Raleigh Radiology called uterine fibroid embolization.
Okay. And of course, my next question is, what is that?
Yeah, right.
It sounds scary. I don't know.
Yeah, it's a minimally invasive procedure. So it can be performed as an outpatient. It's about an hour procedure. So we get access into the artery through either the wrist or the groin, similar to patients that have cardiac catheterizations. We use catheters and wires to get access into the artery that supplies the fibroid. We inject tiny little particles to block up the blood supply, and that causes the fibroids to shrink over time. And that shrinking that occurs allows your symptoms to to go away. And so most women have complete resolution of their symptoms or significant improvement in their symptoms following the procedure. And it's really rewarding to be able to help these women who suffer so severely with this disease.
Right. Not as scary as it sounds. So, with you saying it's an outpatient procedure, what is the recovery time, or is there?
Yeah, that's a great question. So usually I tell patients about 7 days recovery. And so the first 24 hours are the worst after the procedure, just in terms of feeling cramping and pain and discomfort. And then it's better after that. We offer this procedure at Wake Med. And so some patients want to be admitted overnight in the hospital, and then we can do pain medication that way. And then other patients want to have it done in our outpatient setting, go home that afternoon, and recover at home. So we have those two different options for patients, and we really try to get them through that first 24 hours. And then it's about a week till you're back up and able to, go to work and back to your normal day.
Oh, sounds good. So, for someone that's listening and watching right now who says, "Yeah, it sounds like what I want to do," what is the process for them to, maybe schedule the procedure, find out more about the procedure there at Raleigh Radiology?
Sure. So I would direct them to our website at raleighrad.com, and there they can find the number to call to get scheduled for the procedure. So first we see patients in our office for consult and talk to them about it. We get an MRI so that we can better assess what the fibroids look like, what the anatomy is, and go from there and talk to the patient in more depth about the procedure. Also, they could talk to their OBGYN, and their OBGYN could refer them to our office that way as well.
Sounds great. Well, I think that's the sum of most of the questions that I have. Once again, give us the email, or the website rather, for Raleigh Radiology. And is there a number? Sometimes we have women who may be older who would rather call a number to get more information.
Sure. So our website is raleighrad.com, and then they can call to schedule an appointment 919-781-1437.
Sounds good. All right. Dr. Doster, thank you so very much for all the great information on something that really affects us women of color a lot. So we thank you for your time and your wisdom and your knowledge.
Thank you. I appreciate you.
You're more than welcome. All right, ladies, that sums it up. A little something keeping us healthy and wise for our own bodies. And that's what it's all about. Again, it's me, Melissa Wade, in the water. Until next time, God bless you, grace and peace.